The neuromuscular junction is an incredibly important synapse because it's the basis of all skeletal muscle contraction within the body. So as you might imagine, there are a lot of diseases and toxins and even drugs that can affect the neuromuscular junction, and they can be really debilitating. I'm hoping that by spending a little bit of time to consider a couple of examples, it'll help us to reinforce the overall understanding of the synaptic transmission that happens at the NMJ. Now, one thing I should point out at the beginning is that all of these drugs and diseases that I'm going to be talking about in the next couple of slides actually interfere with the normal function of the neuromuscular junction. They all lead to paralysis. But what's interesting is that they all work through different mechanisms. So the way that I would approach this is to think of synaptic transmission as being like a chain of pre- and postsynaptic events, sort of like dominoes. Event A leads to event B, leads to event C. And when you're studying, you can use some of these examples to see the effects of stopping the process at different points. So in other words, if I stop the process at A, then I can't do B or C. But if I stop the process at B, then I can still do step A, I just can't do step C. So think of it like a sequence. If anybody is planning on going on vacation anytime soon to the rainforest, one of the things you should try to avoid is poisoning yourself with curare while you're there. Curare is a competitive antagonist that binds to the acetylcholine receptor, and that means that it blocks the binding site for acetylcholine. The indigenous people in some areas coat their hunting weapons with this particular poison because by blocking the acetylcholine receptor in your prey, you can stop all postsynaptic events at the NMJ, and it makes it much easier to immobilize and catch and kill them. Here in the US, curare was actually used for a long time for lethal injections, but there's actually a legal challenge currently claiming that it's a form of cruel and unusual punishment because it induces muscle paralysis without causing a loss of consciousness. Another plant-based drug called ESERINE or PHYSOSTIGMINE is an inhibitor of acetylcholine esterase. Again, that's the enzyme that breaks down acetylcholine. It can be used to amplify synaptic transmission through the NMJ because it increases the half-life or the time that acetylcholine spends in the synapse. Remember that to terminate the signal at the neuromuscular junction, you have to get rid of acetylcholine. And so this drug slows down that process. It's not really used too much these days at the neuromuscular junction because people figured out that this drug can also cross the blood-brain barrier, and that makes it more useful for treating nervous system diseases. So, for example, people are now proposing that this might be a useful antidote to reverse the effects of some types of sedatives. On a slightly happier note, if you're a fan of Grey's Anatomy, like me, then chances are you've heard them talk about this next drug here, which is succinylcholine. Succinylcholine is routinely used to paralyze muscles before surgery. So if you pay close attention in Grey's Anatomy, you'll often hear them calling for SUCCS, which is short for succinylcholine. Succinylcholine is an acetylcholine receptor agonist. That means that it can bind and activate the acetylcholine receptor. It sort of mimics the effects of acetylcholine. But the reason why it's a paralytic is because succinylcholine can't be broken down by acetylcholine esterase. So it doesn't allow for repeated signal transmission. Later on in the unit, when we talk about tension generation, we'll see why this mechanism here makes a little bit more sense as a paralytic. The disease myasthenia gravis also affects the neuromuscular junction. This is actually an autoimmune disorder where the body produces antibodies that lead to the destruction of acetylcholine receptors. Now, when this happens, that all or nothing principle I was talking about before essentially goes out the window because people that have myasthenia gravis might not be able to produce enough end plate potential to start the action potential because they don't have enough receptors to bind acetylcholine. So this doesn't really cause paralysis, but it does cause muscles to get tired or fatigued more easily, particularly muscles that get used often. And so one of the classic diagnostic clues for myasthenia gravis is droopy eyelids. We don't really think about it too much, but we're constantly blinking all the time. You're opening and closing your eyelids, and all that requires muscle contraction. So people that have myasthenia gravis often have droopy eyelids because those muscles get fatigued. Now, not all disorders that affect the neuromuscular junction are due to the muscle side of the synapse. For example, in Lambert-Eaton syndrome, there's a mutation in the voltage-gated calcium channel inside of the axon terminal of the motor neuron. So this decreases the amount of calcium influx into the axon terminal when it gets depolarized, and this decreases the amount of acetylcholine that gets released onto the motor end plate. In this situation, even though the muscle is normal and totally healthy, because it doesn't get stimulated enough, patients can still experience muscle weakness and muscle fatigue. Now, we talk about a lot of diseases in this course over the course of this semester and next semester too. To me, diseases are not only the things that teach us the most about physiology, they tend to be the most interesting things to learn about. So out of all the diseases that I talk about, this one here, Guillain-Barré syndrome, is probably the one that scares me the most. And that's because Guillain-Barré causes a random, rapid onset muscle paralysis. So people that have an episode of Guillain-Barré often describe it as if they were locked inside of their body. Even though they don't lose consciousness, they lose all control over their voluntary movements. Now, Guillain-Barré is also an autoimmune disorder where the immune system attacks the glial cells that myelinate the internodes of the motor neuron. And when this happens, conduction efficiency through the axon slows down, the conduction velocity slows down, and that means that action potentials don't always reach the axon terminal. That means that acetylcholine never gets released, and so the muscle never gets stimulated. So Guillain-Barré usually occurs in response to some kind of immune response that your body is having. And for this reason, it's made its way into the debate over vaccine safety. So people would argue that because vaccines sensitize your immune system, they can cause Guillain-Barré. But this is actually a great example of pseudoscience. It's true that vaccines could cause Guillain-Barré because they do activate the immune system, but the odds are incredibly low that that would happen. And there were a few cases that were associated with the flu vaccine back in the 70s, but the overall odds of getting Guillain-Barré from a vaccine aren't really any higher than your risk of getting Guillain-Barré from the common cold. And honestly, overall, you have a better chance of getting struck by lightning walking down the street than you do getting Guillain-Barré from a vaccine. So let me soapbox for a second to remind you that vaccines are safe and effective and absolutely necessary to protect vulnerable people in the population. It's really important not to let a small propaganda campaign undo years of scientific and medical progress.